Hey, hi, my name is Adriana Salas. Today I'll be talking about Clostridium difficile colitis. This is an infection caused by a bacteria. Its most recent name is Clostridium difficile. It is a gram-positive spore-forming bacteria. Its spores are motile and anaerobic, while its vegetative cells are rod-shaped and pleomorphic. Recently, there has been an increase in hospitalizations, infections, and overall fatality due to one strain, NAP1, which has acquired resistance to fluoroquinolone antibiotics, and this strain does make 20 more times the toxin that most C. diff strains make, which is crazy. So this is how it kind of works. C. diff normally won't turn into an infection. Like you might have C. diff right now in your gut and it's fine because you have healthy normal flora. But if you start taking antibiotics, you become more vulnerable for C. diff growth in your colon. So this bacteria will mostly cause infection in people who have been taking antibiotics or people who have a weakened immune system. And here we have a case where it's just the person took antibiotics, they killed their normal flora, and that is when C. diff spores, and they ingested C. diff spores, and the bile acids in the colon disintegrated the coating around the spore, and basically you have your vegetative cell, which will grow more C. diff cells, and that's when you will have infection as the C. diff cells release more toxin into your body. This is when you will either start taking antibiotics, and if this is a case of reoccurrence, you will take stronger antibiotics. But you know, since spores are like really strong and they survive everywhere, you might get rid of the vegetative cells, and then you might still have spores inside. So that is why if you do have C. diff, you can be infected again just because you wake them up again. And you know, while you're having diarrhea, these spores will enter your stool and you will release them into the environment or animals, or if you're in the hospital, you could infect other people in the hospital. So it's very hard infection to get rid of. So I already talked about how it kind of works. It produces two virulence factors, endotoxin and cytotoxin. Toxin A is found in 70% of the strains. It's a little more aggressive than toxin B, which is found in all the strains. These toxins will basically destroy the GTPases that basically maintain your cells and provide them with healing and adhesion. This will lead to fluid secretion, diarrhea, epithelial injury, and overall inflammation. So this all happens after the spores their coating is disintegrated by the bile acids. These spores, when they're in vegetative cells, will start replicating in less than 24 hours. And there was an experiment done where mice were infected with C. diff. They put 100 spores in the mice, and within 6 hours there was 1,000 cells already infected with C. diff. So it's when you have it, it replicates fast. We don't know though what makes it what activates it to grow over your normal flora. we don't know if it outcompetes the other bacteria in your colon. We don't know if it stops the other bacteria from eating. So it's important that you keep your normal flora in check, just because we know it has something to do with an advantage over that, but we really don't know yet. Incidence and prevalence, in CDC, the CDC in 2011 estimated that 15,000 cells were directly caused by C. difficile infections. More than 80% of C. diff deaths occurred in people who were 65 years and older. It did cause 500,000 illnesses in 2011, when race was put into question. White patients had a higher rate of C. diff infection than Black, Hispanic, Asian, and Native American patients. But this is probably because these people had easier access to health care, and it was just hard for other races to record their CDI rate. 1 in 5 people who have gotten infected by C. diff will have a reoccurring case, just because the spores, they might still be in your body when you get rid of the vegetative cells. Some of its history: it was discovered in 1935 when it was isolated from an infant's stool. Really weird thing is that children might have more C. diff as a normal flora than adults, and it won't do anything to them. We don't really know why, but that's interesting. In 1978, it was discovered that it could cause disease when they took when they isolated the toxins in some of the patients who were infected with C. diff. There has been a couple of outbreaks in the early 2000s. Usually Canada is hit really bad, but recently they have trickled down. The biggest outbreak happened in 2002, and it spread from Quebec to Europe, and there was a total of 2,000 deaths. And here are some of the symptoms. You might have mild symptoms, which involve watery diarrhea for more than 3 times a day, or mild cramping. Severe symptoms is like more diarrhea, like 10 times a day. And it's not normal diarrhea, it's like water. So you get dehydrated and you lose weight, water weight, and your abdomen gets swollen, your kidneys start failing, and you have an increased blood cell count. Your body is just trying to deal with it. And you might go into sepsis too. And they're just more stronger symptoms, you know? The way this infection is diagnosed is through a blood test, colonoscopy, a CT scan, or a stool test. There's no preferred test though. It just depends on the severity of your symptoms. Like, if you're experiencing mild symptoms, they will probably just do a blood test and see if you have an infection, like an ongoing infection. Or if they suspect that you do have C. diff, they will conduct a colonoscopy where they put a little camera through your colon and see if there's yellow plaques in your colon, because those are usually the fluid secretions released from the destroyed cells. And it's very obvious. I didn't want to put pictures here because it's a lot. I don't know if you guys are comfortable with that. And if the doctor suspects you have a hole in your colon, that's when your symptoms are severe. He will conduct a CT scan to see if you have a hole in your body. And in mild cases, your white blood cell count is less than 15,100 cells. And to change that. And in a severe case, you would have more than 15,000 white blood cells in your blood per milliliter. In mild cases, you will have diarrhea with no systemic signs of infections. So no severe, no fever. It's not severe. In severe cases, you start showing signs of infection and diarrhea, more diarrhea, you know. The risk factors for a mild case would be antibiotic usage, previous hospitalizations, chemotherapy, and a feeding tube. Just because in the hospital, bacteria spread really easily sometimes, and you know, it's really hard to get rid of the spores, so it's very easy to find them everywhere. And the risk factors for a severe case would be old age, recent surgery, inflammatory bowel disease, or having intravenous immunoglobulin treatment. A recurrent case, the risk factors for that would be old age, concomitant antibiotic therapy, or comorbidities. Just having other diseases could put you at risk. The immediate treatment would be just stop other antibiotics that trigger the infection, and then you would prescribe more antibiotics for like 14 days, and they would just look at how you're dealing and, you know, maybe add another antibiotic if you're not doing too well. In super severe cases, they give you oral vancomycin, intravenous metronidazole, or they may try a fecal transplant, which has turned out really well. It does give really good results, but there hasn't been a lot of research into why, just because we don't know how this bacteria takes over your body just because you don't have enough flora in there. In severe cases, you would have oral vancomycin, and in mild cases, you would take oral metronidazole. And the risk, if the doctor thinks you're in risk for reoccurrence, they would give you fidaxomicin and oral vancomycin. Fidaxomicin is more expensive, but it is very effective. That's why they don't give it to you like at the first try, because usually it works, you know. Metronidazole and vancomycin. Prevention: just wash your hands with soap and water, not alcohol, because the spores may survive the alcohol. They will survive the alcohol. Just clean your house regularly if you were infected with C. diff, because you might have like dropped the spore there or something. Doctors and nurses, if they are treating someone with C. diff, should wear gloves and a gown. And, you know, if you have someone infected, immediately just give them a private room, just for them to stay by themselves, and take the necessary precautions to stop the spread of the bacteria. And also use antibiotics wisely. Don't take them just because you want to, or, you know, take them when you really have to. Your body's strong. You'll deal with it. Research efforts. Currently there is two vaccine candidates in clinical trials. Phase 1, there's one in phase 1 and one in phase 3. The phase 3 one, they were expecting results by September of this year. I haven't looked much into it, but I will. And that's crazy because phase 3, like, they're already giving it to thousands of people, so that's pretty good. It'll probably get approved. There's many drugs under development, and there is research regarding the appendix. Apparently, it releases antibodies for the toxin A, and they're just investigating how that might come into play when you get infected with C. diff. And there is research of using bacteriophages against C. diff strains currently. And those are my sources. And thank you and goodbye. Have a nice day. Have a nice night.